Welcome to Industry Experts. My name is Mary Ellen Dombrowski. I'm president of the Connecticut River Valley Chamber of Commerce, and this is a program that we are offering to our members to help educate our community. Today, we're presenting American Integrity Restoration, and it's my pleasure to introduce Steve Weir, who's the founder and CEO. Steve has for 20 years have experience in building and construction and repair industry, including restoration of buildings ranging from single-family residential to large commercial structures. In 2016, AIR invested in disinfection technology from Tomy Environmental Solutions, utilizing this stereomist binary ionization technology to combat harmful bacteria and viruses. Steve's an expert in insurance restoration, mold remediation, construction, water damage, biohazard decontamination, and disaster restoration. Furthermore, he's been recognized by the American Biorecovery Association as a certified biorecovery technician, that's a CBRT, and holds a designation of Critical Environmental Reconstruction Contractor, which is a CERC. And so it's my pleasure to introduce to you Steve Weir, President of American Integrity Restoration.
Thank you, Mary Ellen. Thank you all for joining us. Welcome, everybody. Just a brief description about our company. So I got a nice little PowerPoint up on the screen there, but COVID-19 has changed a lot for us. We've been in the disinfection space for about the past 5 years, and really it's never been so much on the forefront as 2020. In addition to COVID-19 and disinfection, we've done biohazard cleanup in a number of, if you can think of, basically bodily fluids and cleanup. That's what we, specialize in. Fire damage, mold damage, water, environmental remediation, mostly inside a building. We don't get to the soils, but mold and environmental remediation, contents remediation. So if you think of somebody has an issue with their home or their business, and all the things that are not attached to the structure, the chairs, the desks, the clothing, we clean that up and restore it. Equipment rental, and we also act as industry consultants for insurance adjusters, for property owners when they're looking for an advocate for them. And the key industries that we serve are multifamily, so that could be condos, apartments, housing authorities. We're active in all three of those industries. Commercial property managers, so if you're thinking of strip malls, an office environment, we interact with property managers all the time. And then healthcare, long-term care, nursing homes, assisted living facilities, hospitals, and outpatient surgery centers. So it's a fairly wide gamut of people who we serve, in addition to our where I got started with single-family residential restoration. So having noted that in the company history, we are here today to talk about disinfection, as COVID-19 has really put that on the forefront. We have this time scheduled for about a half an hour, give or take. And hopefully we'll have questions coming from the audience. We want participation, so feel free to ask questions of Tom or me via the chat button below. And at the very end, we will have a poll. So the purpose of this webinar is to discuss COVID-19, disinfection, and reopening our state. We're going to today focus on Connecticut. Every state's doing things a little bit differently. And we're here really forced to address the COVID-19 in mid-March. And since then, a lot has changed. The information has changed. The statistics have changed. The requirements have changed. The goals of what we're trying to achieve have changed. So initially, we were trying to flatten the curve. I think everybody can remember, whether it be from the federal level, state level, local, everybody was talking about flattening the curve. And as the information has changed, we've learned more. We were also trying to reduce pressure on the hospitals, on our healthcare system. We were trying to protect those of us in our population who are most vulnerable. So you have the elderly, immunocompromised, people living in close quarters. We were really trying to protect um, those communities. And now we're to a phase where we've recognized that we flattened the curve. All the statistics show that. While the rates of infection are going up, I think that's arguably, there are more cases are popping up, but so is the testing. Hospitalizations are coming down, deaths are going way down, at least in Connecticut. So we've achieved that flattening the curve and we're on the downslope, clearly. And so now we're looking to reopen the economy, try to get back to whatever version of normal that we can, as close to normal as we can. And our behaviors have changed, and they continue to change. So every day as information comes out, we're going to change how we react, and hopefully as we know more about the virus, we'll feel more comfortable and we'll have a better, our activities will be perhaps not so reactionary, and we can be more deliberate when we have more information. So joining me today, I'd like to introduce Thomas Licker of Infection Control Technologies and Insurance Restoration Specialists out of New Jersey. Tom is a friend and an industry peer. Tom has over 20 years of professional experience that includes managing the investigation and remediation of environmental, commercial, and residential properties. In addition, he's been involved with the risk mitigation of biohazardous and hazardous materials in relation to the food, transportation, pharmaceutical, and healthcare industries. His company was selected as one of the contractors for the response to the Ebola crisis a few years ago by the state of New Jersey. And in 2011, Tom earned his certification as a certified environmental infection control remediator from the American Council for Accredited Certification. And in 2016, he earned his American Biorecovery Association's Certified Biorecovery Master designation. Tom is also currently the president of American Biorecovery Association. So welcome, Tom. Thank you for joining us today. Definitely appreciate your input. And hopefully when people come out of here today, we'll have a little better understanding of where we are, where we're heading, and certainly want this to be interactive. So looking for those chat. And Mary Ellen, if you see the chat as I'm rambling on here, if you see questions come up, please share. We'll interject the questions in the midst of the presentation as best we can.
Well, thank you for having me.
Thank you, thank you. So start off with the first question that that I have is, what can you tell us? Why is the COVID-19 different than some of the other viruses that we're used to seeing? I mean, we encounter every season. We deal with the flu. We have SARS. We've got the common cold. We've got all sorts of things going through our offices. Kids at school. Why is COVID-19 really caused us to behave so differently? Why has, I'm not aware ever in my lifetime of something shutting down the economy, schools, never. So can you describe to us why this has been why this virus has been different and why we've responded to it so differently than in the past?
Well, let me start the question off by clearing something up. COVID-19 is actually the disease that is caused by the SARS-CoV-2 virus. So this, in all intents and purposes, is SARS. And a lot of people do not know that. Back in when the original SARS outbreak took place, it wasn't as infectious. It was mainly found on fomites, on medical instruments, and people were mainly catching it through healthcare systems. This one's a little bit different, as it's presented itself as a respiratory illness. Similar to, yes, the flu is also respiratory. And I want to also clear some things up as far as what an envelope virus is and what a non-envelope virus is. So there's a hierarchy of how difficult a microorganism is to deactivate. And the envelope viruses, which are surrounded by a fatty lipid, are the easiest to deactivate. But an envelope virus is also the easiest or the most easiest to infect people, should I say. If this was a bacterium, a non-envelope virus, or anything, a spore or anything that's it's higher on the hierarchy, environmentally significant wise, I'd be a lot more terrified if it was infecting people this quickly. Envelope viruses infect people very quickly. They enter the body and they have a series of protein spikes on the exterior of them. And those match up with the cell wall and they start replicating. This is another common misconception. Viruses are not alive. They're basically genetic material that gets, it's so there's no, there's no bacterium and there's no living organism. They just invade cells and start replicating RNA in those cells, and that's what's making you sick. So we really have to educate our folks on what these types of different microorganisms are, and how they go about infecting people, and why this is so quickly. Just like hazardous materials, we were dealing at the front end of this with a completely unknown. It was called the novel coronavirus initially. Novel means new. And when this started erupting in China, and how many people were getting infected, and it's even said that China kept this under wraps and didn't tell anybody for a while, and we had transportation from airlines, trains, everything starting to spread this thing. And regardless of where it came from, in our reality today is something that we have to deal with and learn to live with. It's not been an easy road for anybody, or the globe for that matter, to be able to wrap their hands around it, including our own government, and the amount of misinformation that has been put forth out there regarding the virus. So with that said, I just wanted to clear a couple of things up on the front end of that question. So we're looking at a microorganism, or should I say a virus, that is mainly transmitted from person to person. And you have to receive a viral dose, in order to present itself as an active infection. The problem with it is you only need one person to start that chain reaction. And how do we go about as a community to address those the concerns of the people out there?
Okay. So as we're now starting to open up, we're opening up hotels, we're opening up restaurants, allowing more people into different buildings. If we're talking about what I wanted to focus on in this question is some of the challenges for the businesses, perhaps their employees, and also the patrons, people coming back to some of these businesses. Can you talk about a disinfection plan? For a business who's going to reopen, what they should consider focusing on, and maybe some best practices?
Oh, absolutely. Thank you for asking the question. There have been a multitude of methodologies out there in order to help mitigate circumstances of catching this, or any, should I say, any infectious agent that could be presenting itself on surfaces. And you just don't clean for SARS-CoV-2, COVID-19, what have you. You're mitigating the circumstances of transmission. And that's the most important part, and most important thing that you can probably do from a facility hygiene perspective. And I always ask people, what is your plan for maintaining facility hygiene throughout your business cycle? And a lot of times this ends up being one of those, well, I don't have one. We just shoot from the hip. Or that's what I hire my janitorial company, or that's what my staff does internally. But how are you maintaining that building or that facility in a proper manner that not only makes it more efficient to run, but also helps keep things cleaner? You know, along the lines, that also keeps pests down, it keeps other things down. So there are inherent benefits to having a proper facility hygiene or disinfection program as a top-down model. Now, what we recommend is that you look at a building, you have to look at it just not cleaning for appearance. Tons of, and that's what janitorial companies mainly do. They clean for appearance, they make it look nice. But we do not clean for health. And you know, unless you're a kitchen or something around where there's a high risk for surface transmission, or you know, a contaminated person such as, you know, cruise ship disease, you need one you know, infected food handler to essentially start to spread norovirus, and that runs a chain reaction on the cruise ship, so people get sick. So, you know, with that said, I look at things from a distance. There's two different things. There's cleaning for facility hygiene, and there's a disinfection plan or a facility hygiene, you know, maintenance plan that you have to consider putting into your standard operating procedures. And in today's environment, with this bug going around, you know, we've consulted a multitude of people, companies, especially on the food industry side, like what, you know, because they work in such close quarters with each other. And as we've seen with the meat packing facilities and the other processing facilities, that the virus can spread really, really quick if you know, if precautions and proper standard operating procedures are not put forth. So, you know, with that said, you know, first things first, defend yourself. Okay, if you're in a high risk profession, you know, outside of healthcare, look at the similarities. Are you in close quarters or within close contact with people? Barbershops, beauticians, you know, nail salons, things where you're operating on a human being. Essentially, your operation is direct interface with human beings. That's going to be probably the highest risk pool. So your disinfection plan might be a lot more stringent in those environments. You know, dentist office, for instance. Though, you know, you may be doing a disinfection or a hard surface wipe down every hour on the hour, and then, you know, so if you're not really interactive with people, and you have a social distancing, you know, you can keep social distance, then your protocol might be, all right, we're going to do this once every 2 hours, or if we have a group of patrons coming in during a very busy cycle in the business day, you know, how are we addressing, and how are we showing that we are mitigating the circumstances of transmission. And so I think, Steve, it's going to vary according to what type of business you are. Do you have direct human interaction, or do you not have direct human interaction? It's kind of, to me, it's kind of common sense. But, you know, again, I look at things holistically and not, you know, just what's on the surface. And what protocols can you put in place, you know, shields, what type of shielding, what type of engineering controls can you have in place between you and the interaction with a human being?
Okay. So is this, what I heard is, you know, this is something that should be regimented, right? You're going to determine a timetable, a frequency, But
Mhm.
I imagine this is something that probably should be put into writing I know when we talk about plans internally, not much is done verbally or it gets forgotten. So when we talk about a disinfection plan, is this something that you'd recommend having in writing, perhaps with a checklist, just to remind people not to miss steps?
Absolutely. And a good checklist is, a lot of people think that you can just spray a disinfectant and leave. And we see a lot of that happening out there in today's business environment. All of a sudden people are searching for revenue, they're desperate, and we have companies that are popping up all over the place claiming that they're all of a sudden infection control experts. And that's why, associations like ABRA and their certification programs are so important to the business community or to the consumer in general, because at least it gives you a peace of mind saying that, this person is certified and are held to a code of ethics. So, with that said, what we have to do is, in any type of situation, if you have gross filth, the gross filth has to be removed by good cleaning practices first. Okay, you have to get down to that surface, and I've seen some stuff in even some pharmacies and stuff like that that I've gone into, and they haven't. I don't think they've ever cleaned these areas. They're dusty. They have they're so busy just doing you know their daily business activities that cleaning is really, or proper cleaning and facility hygiene is really on the back burner, and it comes out of the bottom line of the budget. And in a lot of cases, you can put profits ahead of proper facility hygiene. At the end of the day, that's going to turn around and bite you one day. And so we can actually show that buildings behave better. They become more efficient if a proper disinfection and facility hygiene plan is put into place.
Okay.
That's and you have to clean prior to disinfection. There's no getting around it unless you can unless you have somebody who is pre-cleaned before you disinfect. Then you're really not, because you can't disinfect dirt.
Yeah. I know that we, in our travels, had been asked, and when people were comparing quotes, people have been getting multiple quotes, and a lot of the quotes that we were providing included that, that wipe down and cleaning prior to disinfection. And a lot of what we were finding in the industry was not apples to apples comparisons. A lot of the quotes, competitors' quotes, and other people were under the misconception that you can just take a dirty surface and spray a disinfectant on it. So by the gross filth, if I'm hearing you, I think if we're talking the same language, oils from your hands, dust, debris, if you're not right down to a clean surface prior to disinfecting, you're disinfecting dirt.
Right, and you look at biofilms is what they're called, and in a lot of cases they're very hard to see. I'll give you, for instance, look at an iPad or your Android device, or I didn't mean to be marketing anybody's products, but look at a touch point surface like that and just flip it like this and look at it in the sunlight, and you will see the biofilm built up.
Yeah, people
That's
probably don't want to do that. Don't look at it. You'll be horrified.
True enough, but at the same time, that's what's building up over time. They're dead skin cells. They're stuff that could harbor microorganisms that is relatively unhealthy for keeping buildings in top condition.
Okay, let's jump down to talking about what are some of the things that you referred to the budget, and a lot of businesses are getting back up and running. They've been closed for weeks, months. The budget, I don't blame anybody for having the budget be a major consideration, right? So you're trying to balance budgeting with making sure that your facility or establishment is safe and clean. Can you talk about maybe some of the things that somebody could do on their own as a business owner, why they might consider hiring a professional, from a consumer piece, from an employee piece, liability piece. Can you touch on a business just cleaning and disinfecting themselves versus hiring a professional?
Absolutely. The businesses can do a lot of their own stuff. Okay, I'm not, but at the same time, if you're in a high-risk pool of businesses, like we discussed before, you might want to consider hiring a outside resource that can help not only do things properly, because there's training involved, aseptic technique, using I've seen people use the same rag from the beginning of a room to the end of the room, and all they're doing really is spreading the filth. We use a process that uses a disposable microfiber cloth. And why you want to use microfiber? It holds dirt. It does a very, very good job. And we got that from the pharmaceutical clean room industry. It does a fantastic job of pulling dirt off the surfaces with a surfactant. So you're using something that's going to pull those proteins off, and you're going to get down to the raw surface. Now, when you see a cloth get dirty, you don't want to dip it back into a clean bucket of disinfectant or cleaner. That's, what did we talk about before? Dirt deactivates the disinfectant. You can be diluting the efficacy of that product. And you want to follow the directions on that product to a T. It is actually illegal to dispense or apply a product in a way that's not consistent with the label. And the EPA registration, the label on that product is everything. So it's the law. And we see a lot of people using fogging devices for products that aren't approved for fogging. And disinfectants themselves are registered with the United States EPA as an antimicrobial pesticide. So do you need a pesticide license to apply these as a business owner? No. Okay. But in some states, not all of them, they have you have to be licensed in order to do this properly. So Steve, you talked about liability, and what you can do, and I see litigation in the future on this. I just do, not to scare anybody, but if you can somebody get you for negligence for not doing this. It's going to be very doing this properly. It's going to be very hard to prove where you got the virus from or any type of illness. But what hiring a professional or a certified company to do this properly also helps mitigate some of that liability.
Steve, I'm sorry to interrupt, but there's a quick question, and we're rounding up around half an hour now.
Yeah.
Question is, what's the best method to clean biofilm? I'm not sure if you already addressed that.
Yeah, it's we use you can use steam. You can use we prefer the microfiber rags or cloths with a cleaner. It can be any type of surfactant based cleaner that's going to allow water to penetrate those biofilms. And you know what? It takes elbow grease. You have to scrub and you have to clean. There's no way around it. And then you apply your disinfectant. So yes, it's labor intensive. It costs man hours to do it right.
So we have a couple more questions left. I know we're coming up on just about half hour, as you mentioned, Mary Ellen. Probably got 6 to 8 minutes left before opening it up to the poll. But What I wanted to mention, Tom, you talked about professional versus, the business owner or homeowner disinfecting and cleaning on their own. One of the things that we found, obviously using the chemistry to following the manufacturer's label to a T, as you mentioned, but also when we're talking about liability, and I guess this is as much of a question as it is a statement, but can you discuss a little bit about what type of documentation might be expected from, if you're hiring somebody to come in and clean, what type of documentation you might expect them to provide you with at the end of the cleaning, the disinfection, after them performing the service?
Great question, Steve. We have something in the United States called a right to know. And you have a right to know as a business owner what type of chemicals or what chemistry is being used in your business to mitigate so-called, the COVID or mitigate the risk of getting COVID-19 or any type of illness for that matter. And what, does it have the efficacy strength to, required for that type of disinfection? And is the contractor applying it correctly and according to the label? As a business owner myself, if I had to bring in somebody, I would want to know the SDS, give me a copy of the SDS sheets, your process, and any type of backup that, are you doing ATP testing on surfaces? I get into that, but
and ATP is just a well, you touched on a couple more things. SDS
right.
is the safety data sheet, right? So it's
Right.
what's the makeup in the chemistry that's being used, and the ATP is basically a level of cleanliness, right, for bacteria.
Absolutely, it's a qualitative surface test, and a lot of janitorial companies or your standard cleaning for appearance companies do not have those swabs, and it's an instantaneous readout that you can get by swabbing a surface, and it tells you how clean that surface is. We got that from the food industry, and because they were worried about transmission of Legionella, or not Legionella, Listeria, and just by using those tools and for facility hygiene tools that we've adopted from pharmaceutical and the food industry, we've provided a much, at least gives you a qualitative readout of how well you've managed to clean that surface. And a lot of people don't know about this technology.
Steve, we have another question.
Sure. Go right ahead.
How long do disinfectants last before the elbow grease cleaning is required? Or is it reverse?
It's reverse. So the elbow grease is required on the front end.
Right.
And the disinfectant is only as good as the next person that comes in and recontaminates that surface.
Okay.
So that's why staying diligent with a process of disinfecting is very important in today's environment.
Another question, how do you get the ATP tests? Are they available?
I'll let Steve answer that question.
Yeah, I believe those can be purchased. I'm not in charge of purchasing here. They've taken away my credit card. No, I'm just kidding. I don't handle the purchase of our supplies anymore, but those are readily available, probably a Google search. I'm not sure you could buy them on Amazon, but you might be able to. They come in kits. I imagine it's got to be standard fare for a lot of our local health departments. So not rocket science by any means.
Another
unless you disagree with me, Tom.
Oh, excuse me. How about something like Microban 24-hour disinfectant?
I've read a lot of claims out there, and they're usually putting something in there such as silver or but is it EPA registered? And for longevity, for this virus, I have not seen anything that is actually EPA registered that proves long-term efficacy against viruses.
And I have heard some claims out there of new products, emerging products, but nothing that we've tested. You know, we're going with the tried and true internally here with the things that we've used for years that we know are green products where possible, where they're not going to damage the surfaces you're putting on them, not going to introduce chemicals into our environment as to whatever extent we can avoid it. So maybe we're sticking with the tried and true. So there may be some new things out there, but I don't really want to test them out in under the gun when we haven't had time to. But though they may exist, I don't want to downplay that. But the stuff that we're using is only good until the next person sneezes on it. So important to keep that process. Last question, because we're coming up on certainly over 30 minutes now. Talk about the high-risk establishments. I know you talked about them, but I'm not sure we identified. What would be example of 2 or 3 high risk, and then maybe some establishments that might not be considered high risk, and how you might treat them differently, how people might behave differently in one of those.
Absolutely. So places where you get groomed, your haircut, beautician, barbershop, those where those people have a direct interface with people, and that could be that could be said the same for healthcare. The emergency room, you have a revolving door of humanity coming in there, and it's the same thing, and you're dealing with humanity in close proximity. So the owners of these facilities, we just recommend that protect yourself. What are you doing in order to prevent you from receiving that virus? And are you making people put a mask on, or something that's approved, or a shield of some sort while you're cutting their hair? And it's going to be very difficult because not everybody has access to instruments of infection control. They're very hard to find these days. A shield, for the beautician, I think is a very good thing to have. An N95 respirator, if you can find them. Their supply chain is catching up. So we're seeing availability more and more. And a pair of safety glasses. What you don't want to do, and a pair of nitrile gloves. Essentially you're a frontline worker when you're dealing with these people. And what I want you to do is consider protecting yourself as best possible. The virus is not going to penetrate your skin. Okay, viruses do not penetrate your skin. What you have to worry about is your soft tissues, your eyes, nose, and mouth. I think we lost Steve there.
I'm here, apologize. And then how about a bar? I don't think I heard you mention bars. I know that's been a bone of contention around here in Connecticut, but
people like their drinking establishments, don't they? I think that's going to be be outdoors as much as possible, because the solution to pollution in a lot of cases is dilution. The servers, it would be the same thing. If I'm an employee in a bar or a restaurant, I would want to be geared up the same way a beautician or a hairdresser is going to. Protect yourself. The OSHA says, in the general duty clause, that employers have to provide protection for them. That's going to be another bone of contention, I think, coming up, is how does this apply to Department of Labor laws? So yes, there are variables that are going to impact this industry in the United States in general. If you're, do what the meat packing and food processing facilities are doing, you have to do something similar to that because you're in direct contact with humanity. Have a policy where they have to, unless they're, getting their hair cut and, make them wear a mask if they're sitting in, waiting in line 6 feet apart. There's a lot of signage companies out there that are, you see the placards on the floor saying, remain here, and then you'll see it at the supermarket even. So just be diligent. Even though our cases are dropping, we are seeing mutations in the bug, which, it could make it more virulent. So stay diligent and stay conservative on this as best possible. But we have to open up. We have to start commerce. We have to start bringing revenue in for our companies out there. People's livelihoods are on the line right now. And there's going to be a balance. We're going to strike a balance. But as long as we do it conservatively and do it in a methodology that protects mankind, it'll go a long way.
Thank you. Mary Ellen, do we have a few minutes for a poll?
Sure.
For the poll questions, I think we had 5 questions if I'm correct. So I guess here's where we'd ask anybody who's able to get your mouse out and click on a yes or no. Get these questions, appreciate you answering them. Have you opened your business? Are you planning to open soon? You gonna reopen? I've got a plan, and I'd like to know more about a disinfection plan, and that, answering those would be great. That would be great information to have.
Also, Steve's contact information can be found in the chat. Tom, I don't know if you wanted to add yours in there too, and if anybody would like to enter theirs, you're welcome to do that. The chat can be saved at the conclusion of the presentation.
Okay.
All right, everybody have a chance to, can you see the results? Or is that just what I see? I'm going to end the poll. Everybody vote? Okay. All right. Have you opened your business? 89% have, and 11% have not. Are you planning to open soon? 67% said yes, and 33% said no. Not going to open, 89% are not going to open. And I have it
backwards.
I'm sorry?
I wonder if that's backwards the way it was worded. Not going to reopen, yes or no. So I'm, anyhow, I hope 89% of us will still be around.
Right. Maybe that means right now. I have a disinfection plan. 78% do indeed. And I would like to know more about. We have 44% would like to know more.
Okay. Well, I would say feel free to reach out to me. My contact information is in the chat. This has been recorded, so we'll be throwing this out on the web. So the same way you were notified of this live event today, you'd be notified of the recorded event and how to get at it for any follow-up. And I'd just like to thank everybody for being here. Very much. It's obviously is informational for me to understand what other businesses are doing out there. We've been essential. We've been open throughout this whole thing, serving a lot of other businesses and residences. And at times it was quite eerie being out there and the roads being empty, almost like a blizzard. The office here being nearly empty with people working from home and remotely. And it's pretty awesome to see people back out and about. Although I could do without somebody driving 25 miles an hour all the way home. It was really nice to speed at the end of the day. But I am thankful for all of you participating and just giving us a perspective as to what else is going on out there. And thank you and wish you all well.
Thank you very much.
Thank you for joining us.
Thank you for having me.
Thanks, Tom, very much. Have a great day.